along in our lives, basically. Yeah.
Sorry, still trying to get used to this mic. Yeah, of course, we all know what health is, what well-being is, that living healthy, we know the results or what will come out of it. If we live a healthy lifestyle, there's chances that we're going to prolong our life, we are going to like delay or prevent disease occurrence. And we are all familiar. There's nobody that is like, especially with the COVID, kind of make a lot of us to be aware of so many things going on about our health. So it's, when we talk about health, we talk about general well-being, Dr. So, and I believe it's something that we practice. Well-being involves taking care of our health, physically, spiritually, mentally. That's what well-being is about. It's not just about disease, being disease-free. It's about physical well-being, spiritual well-being, emotional well-being. It's an all-round thing. So simple stuff that we do actually kind of help promote well-being.
So we have Dr. Adefori with us. Like I said, he's more into internal medicine. And so just like Dr. Ogunde has spoken, what do you see, what should we always look out for as we go along in life? You know, some people say that, some doctors will say at some certain age you should check some things. What do you typically tell your patients?
Good morning, everyone. So maintaining health, you know, there's a saying that prevention is better than cure. And there are different phases of how you can manage your health. Do you want to manage it from the preventive aspect, or you want to have a disease and then manage it from that aspect? So prevention is always better, it's cheaper, it's easier, and it prevents complications. So it's something to think about as we age, because our body is changing. So you have to do certain preventive measures, some preventive procedures, which I think we'll talk about down the line. Yeah, so, but to navigate all that process, what you need to do is have a PCP or a doctor who will help you move through all this as you age along the way.
Okay, so we're going to talk about some things, but by all means, if you have any questions, please just you can raise up your hand. Somebody will bring a mic to you, and you can ask your questions. I think there's some things that, you know, I put them down here as the dangers ahead. And some people tell you, check your blood pressure. Make sure you're always checking your blood glucose. Make sure you're checking your cholesterol. Let's talk about blood pressure. How important is blood pressure? What are the issues that can come with blood pressure? And, you know, what is the ideal blood pressure?
Okay, so before I answer that question, I want to bring to our awareness that there are three basic primary preventive measures. We have the primary prevention, the secondary prevention, and the tertiary prevention. Primary prevention is when you prevent the disease before it even occurs in the first place. That's where vaccination comes in. That's where living healthy lifestyle comes in. That is where avoiding smoking and all of that comes in. The secondary prevention is screening, involves screening. That's when you identify the disease before it causes signs and symptoms. So yes, you may have it, but you may not have shown any sign or symptom. So that's where screening comes in. And that is where this hypertension, diabetes come in. That when you screen early, you can delay the progression or you can delay complications. And the tertiary is when you already have the disease, and that's where the primary care comes in. They are now taking care, managing the disease or managing complications that come as a result of it. So going back to screening, going back to that question of hypertension, of course, there are certain guidelines and certain age group. I think it's from 18 that people can start checking their blood pressure. Of course, they revise the normal, But preferably, if it's less than 120/80 is the ideal. So when you start noticing that trend, your blood pressure is going over 120/80. Of course, we have stages, stage 1, stage 2. Then it's something that you need to start doing something. And that's when doctors advise that, okay, you want to reduce your salt intake, you want to exercise, you want to live healthy. So those are the things. If you don't go to your doctor, you may not even know. And that is why they call hypertension a silent killer, because it doesn't give any symptoms. It doesn't present with anything. By the time you know it, the first symptom they may present with as a result of hypertension may be stroke, because the high blood pressure doesn't present in any way. So it may be in the system, and your blood pressure may be running in 190, 80, 190, 100, but because you are not feeling sick, so you don't see any reason why you should see a doctor. That's why the screening, the second preventive measure, is so important. Annually, if we reach certain age, by the time we clock like 40, we should start seeing our doctor on an annual basis. They can screen for high blood pressure, they can screen for diabetes, and so on and so forth.
I also want to add that I know there's a myth that we think you have to be old to start having high blood pressure. I've seen very young people, 20s, 30s, with very bad high blood pressure in this country, even back home as well. So to start with, being black, we are at an increased risk of having high blood pressure. And so it's commoner amongst blacks. Everybody knows that it's a well-known phenomenon. But let's not think that you have to be old to have it, because it's extremely common among the young. And I'll say that I've seen a lot of people who are young, in their 20s, their 30s, and they just don't only have high blood pressure, but they have very bad high blood pressure that they need multiple medications to control it. So let's not think because we are young, we can't have it.
I'm going to throw this open. When is it bad? When should, if you check your blood pressure, you should be alarmed? Is it that when you do it one time and you have something that's very high, or it has to be over a period of time?
Yeah, based on the recommendation, blood pressure one-time reading is not conclusive. So, yeah, of course, if you check one time and you are seeing like 160/100, 160 over or 200 over 110, of course, you need to go to the emergency. But ideally, if it's like, okay, greater than 120, you are running in like 140, 90, that's one-time thing. So the recommendation is for it, assuming you go to your doctor and they check it, it's like 140/90. Yes, they are not going to conclude that one time. You have to take another reading outside the hospital setting, because there's something they call white coat, whatever, like you're afraid because you're in the doctor's office, that may not be a true reflection of your blood pressure. So they have to recheck it outside of the clinic. So if it's consistently high, then they may tell you, if it's something that is not that bad, okay, modify your lifestyle, reduce salt intake, exercise, eat healthy, and advise you on that. But if those doesn't work, they may have to start your medication. So one-time reading, if it's really bad, it may be an urgent thing that you need to go to emergency for. But one time that is still like in stage 1, early stages, the doctor may have to do a second reading to confirm that you are actually hypertensive, you have high blood pressure.
And what other things can hypertension lead to? I guess that would be a question.
Well, it can cause anything you can think of. Stroke from the brain, it can cause blindness, it can cause a heart attack. It coexists with other disease conditions like diabetes. If you have high blood pressure, the chances you have diabetes is extremely high as well. So it goes with diabetes. It can, cause kidney problems as well, and cause end-stage renal disease. And we've seen young people who down dialysis just because their blood pressure was high, they didn't control it, and now their kidneys are shut down, so they have to be on dialysis all their life. So you can, it's like we said, it's a silent killer. It can cause disease for every part of the body you can imagine.
So let's move to blood glucose. That's what eventually is diabetes, right? What are the things we should look out for? When should we start checking our blood sugar? And at what point is it? Do you know? There's pre-diabetes, right? And at what point is pre-diabetes curable? Maybe that's the first question. Then at what point is it like the house is on fire type of issue?
Okay, for diabetes, I think, yeah, for diabetes, of course, there's recommendation that you need to start checking your diabetes. I'm not sure, but I think it's around 40. But if you are obese or you have family history or you have other existing problem, you may need to start like screening early. I may need to confirm that it's 40, that, okay, once you eat 40, because some people may have, there are two different types of diabetes. Let's be clear about that. The type 1 diabetes and type 2 diabetes. The type 1 usually present early, is when there is a problem with the pancreas or it's not secreting insulin. But the type 2 could be as a result of insensitivity. Your body is producing insulin, but it's not really sensitive. So, and that one can present now we're seeing a lot of diabetes presentation in young people. Normally it used to happen as people age, but people are actually presenting with type 2 in early stages. So to answer that question of prediabetes can be like diagnosed based on 3 factors. The fasting blood sugar, if it's higher than usual, like you take a reading is greater than 110, don't quote me, you need to double check. The fasting blood pressure, if it's
maybe we should tell them what fasting
blood sugar, before you eat, they want to see the blood level. So if it's greater than certain value, it may be an indication. And the A1C, hemoglobin A1C too, they want to check. If it's like between 5 point something to less than 6.5, that may still be like, it's more accurate in telling you if your blood, because it gives an average over the last 2 to 3 months of what your blood sugar runs in, as in what it runs in. So A1C is more like, gives more information. So if it's less than like 6.5 or thereabout, it may be an indication that you are pre-diabetes. If it's greater than 6.5, that is more like diabetes. So the pre-diabetes is preventable or is reversible in the sense that if you change your lifestyle entirely, it may not progress to diabetes. So that's the good part. Yeah, so if you like running in pre-diabetes, your doctor will warn you, yes, if you don't want this to progress from pre-diabetes to diabetes, change your lifestyle, lose weight. That's when those preventive things come. If you are smoking, you want to cut down, you want to stop smoking. If you are taking alcohol, you want to cut back and stuff like that. So yes, I read recently about diabetes that some people say, oh, is it curable? Yeah, it's not curable, but you can go into remission. Yeah, you have a full-blown diabetes, but if you change your lifestyle and you stick to the healthy lifestyle, you can maintain a healthy blood sugar. Of course, if you change, it will come back. So it's going to be like cancer, that you go into remission, you are maintaining healthy blood sugar, but if you reverse your lifestyle, yeah, it's going to come back with very vengeance, and you are going to have a full blood sugar again. Amen.
Do you want to say something about that?
Yeah, so yeah, I agree. The main thing is from everything we are saying, if you're pre-diabetic, you have to work on it. Exercise, diet, and it's a conscious effort. It's not, you're not going to do something today and, not be consistent. You have to be consistent about it. And it's that conscious effort, consistency, that eventually will see you through. And I've seen people who, they are pre-diabetes and they never get into full-blown diabetes because they are doing the right thing.
But I guess when you talk about type 1 diabetes, that is more like almost hereditary or ingrown, or is type 2 diabetes caused by eating too much sugar? I know there are some people here that want to ask that question. You can ask your question, sir.
Food and exercise. Let's focus on food first. 3 questions. Is fast food good? That's number 1. What are the foods? I know you guys can say, oh, check it out, this and that. But what are the main aspects of food that we Africans, we are used to? Because for me, I have just few food that I eat. Bread is my food. Rice is my food. Every day they are telling me I will get some salmon, even I preach, but When I get home too, I will get some salmon and stuff like that. So my question is, how will I survive? The, the thing is that I don't eat. People don't notice that. My kids, if I count all the food I eat, probably about 7 of those food have. So the food I eat is the one that they are telling me not to eat. So how will I survive? So that is number one. Can you help me tell my kids that is salt good? Because with everything, we are still adding more, so I don't know. So you guys can help me out.
Please help Pastor out so that he can survive.
Yeah, it's like 3-in-1 question. So fast food, it's not really the best food to eat because it has, of course, the things that brings people back to it. It's high in salt, it's high in sugar. There's no moderation when it comes to fast food, and it has preservatives, So you are eating those, whatever, I'm not going to mention them. It's so salty. It's like, you want more of it. So those things are not healthy. It has a lot of sugar, all the sodas. You want more of it. Those are not healthy because those things are going to be broken down in the system. And most of it, if people rely on those things, they are fat. The fat content is so high. Nobody wants to eat too much fat. You don't want all those high fats. You don't want so much calorie because it takes a long time for the body to break some of those things down. So you want to it's not, once in a while, I don't condemn people that, don't do this. It's so hard when you say, don't do this, cut out everything. But do things in moderation, maybe once in a month. Some people say, I'll give myself a treat day or something. Yeah, you can do once in a while. So when it comes to African food, yes, most of African food is so notorious for causing all sorts of things because it's mostly starch. And this thing gets broken down in the system. And of course, we are not exercising. Because what causes obesity is there's an imbalance between what you're taking and what get out of your body. We are consuming all of this calorie-dense food, and we are not exercising. We are not getting rid of it. So what does it stay? It stays in the system, gets converted into fat. So we are back to square one that we thought, so especially bread, we advise people that have high blood glucose to reduce their bread intake. And that's why there's wheat option. That, you can take the wheat part and all that. Those are less sugar, less salt in it. Of course, salt too is bad for anything. Too much salt, sodium is not healthy. Yes, too much salt can increase your risk of having high blood pressure. That's why we discourage to reduce salt intake. And salt can come in any form, especially when you add additional salt to food. You are compounding, you already cook with salt, you are adding additional. That's increasing the salt content. That's sodium. Sodium retention increases your risk of high blood pressure. So we try to avoid that. And there is this dietary recommendation that in your plate, if you have a full, as in a regular plate, one portion, half of the portion of the plate should contain fruits and vegetables. Africans, we just put everything, all the pounded jam, all the eba, we put everything. But ideally, that is not the recommendation. Half of your plate should contain fruits and vegetables. 1/4 of it should have grain like wheat bread and all of that. And half of it should contain protein, lean protein. So fish, if you're eating chicken and you're getting old, you want to remove the skin. You want to eat more of fish, things that are less in fat. And use the healthy oil, like canola oil, vegetable oil. Those are better oil to use because they are more saturated, I think. Yeah. So.
Does that answer your question, Pastor? Yeah, that's all the food he eats. So. Okay, talking about fast food now takes me to cholesterol. And, the question will start from you. They say there's good, which is HDL, right? And there's bad cholesterol. So what's your take on it? How do we deal with high cholesterol? When should we start to worry, when you have high cholesterol?
So, like I said earlier, high blood pressure, diabetes, all these things go together with what we also call hyperlipidemia. So if you have one, it's a vicious cycle. You have high blood pressure.
For everybody, hyperlipidemia is high cholesterol. That's just the medical term for it.
Yeah. So it's a vicious circle. One leads to the other, leads to the other, leads to the other, and the combination of everything is what causes stroke, heart attack, kidney problems, and everything. There are people that they have familiar or like family tendencies to have this, and that's why those people, with time, with regular screening, hopefully they find them from their blood test. But others is just because of what you eat, you're not exercising well enough, so you have all this cholesterol building up. And those three things, high blood pressure, diabetes, high cholesterol, is the same preventive mechanism. Reduce fat intake, reduce salt intake, exercise. What works for one, works for all the three. So as long as you can keep doing what you're doing for one, you're invariably also helping those, the three B's, I'll call them. Yeah.
Do you want to say something about good and cholesterol?
Of course, we all know the HDL is the good cholesterol, the LDL, the low density lipoprotein, they are the bad cholesterol. So, of course, there are some food that they said, okay, it helps increase your HDL. I don't know how true that is, but yes, at least eating healthy too, we all know is good for everything. So eating healthy will probably, like if you are eating all the bad fats and all those things, if you try to reduce it, probably you'll be able to keep your LDL at a reasonable level, that it won't go to a higher level to give you hypercholesterolemia. So, yeah. It's the same thing, hyperlipidemia, hypercholesterolemia.
Sorry. I'm sorry. So, I think now we have to talk about if we don't have any questions, sometimes the elephant in the room. I lost a friend last week through cancer. They found out pretty late, found out in January, and she died last week. When should we start to screen for cancer? And what are the type of cancers we should screen for? At what age?
So there's been a lot of advance in the field of medicine in terms of oncology, cancer. And it's well known that since they started screening colonoscopy, it's drastically reduced the incidence and prevalence of colon cancer. So I think when I was a resident, the teaching then was at 50 years of age, everybody should get a colonoscopy. But over time, they found out that blacks are more prone to having it at earlier ages, so they moved it down to 45 years. So at 45 years, and I heard the insurance companies are paying for it now. I was having that discussion with someone last week. It took them forever, but now they're paying for it. So now they're saying at 45 years of age, you should go get a screening colonoscopy. And because if they pick it up early, the chances of cure is extremely high compared to picking it up when it has metastasized, and that means it's gone to different parts of the body, and then it's hard to treat. So colonoscopy is well documented, it's well known, the science is clear. If you are 45 years of age, go get your colonoscopy, because you never know what they'll find. And the good thing is just once in 10 years if they don't find anything. If they find something, they may want to screen maybe every 2 years, every 3 years, or every 5 years. But at least they'll be on top of it before it spreads to other parts of the body.
Yeah. What about prostate cancer? Is it the same thing?
So prostate cancer for men, you could have a digital rectal exam where they can feel the prostate. And then there's also the PSA, which is a blood test, to see if it's extremely high. That's really indicative of prostate cancer. So those are additional screening tests as well that can be done.
Which other ones do you think, especially for women?
Yeah, we know breast cancer too is something that people may want to screen for. Some recommendation body recommend 50, but if you have family history or other thing, they advise that you start screening as early as 40. Even some people that with strong family history can start as early as possible. Yeah, those are like the common one, the breast, the colon cancer. Of course, the prostate, if you have a family history, of course, somebody will have to start screening early too. And there's still a lot of debate about PSA and all of that. But if you have a tendency or strong family history, you can talk to your PCP and get the screening started. All other cancers, it depends on family history or what, that you kind of like talk about it and want to screen.
Okay. So just another comment about colon cancer. So if you have a first-degree relative who has had colon cancer, the recommendation is actually that you should screen 10 years before.
Can you explain what you mean by first?
So that means like brother, sister, mother, father. That is the first-degree relative, immediate family. Any family history, if anybody in your immediate family has had colon cancer, you are at a higher risk. So even 10 years before, you should start screening. So if everybody's screening at 45, that means at 35, you should start considering doing colonoscopy. I know it's the general, there's a myth about colonoscopy where people don't like colonoscopy, and especially black people don't like colonoscopy. The prep. People don't like the prep. And people don't like the fact that they have to go in through the colon to look at what's there. And I've
you have to explain what you mean by going in through the colon.
Yeah, so colonoscopy is, we have two openings, your mouth and then underneath, right? So what the doctors are doing is you have to drink, there's like a gallon of liquid that will help you flush out any stool, so that when they go in, so they then go in through the anus and with a camera, just think about it that way. It's like a camera, and it will go through all your colon to see whether there's anything that is suspicious of cancer. If they find anything, they'll take a biopsy, and then they'll look at it under the microscope to tell them what it is. At times it may be nothing, at times it may be something. So that's why I said if they find something, they may then decide, okay, based on what we found, we need to follow you up more closely. So maybe every 3 years, every 5 years, depending on what they find. But if they found nothing, which is the good part, you wait for another 10 years before you do another screening. Yeah. And now there's also, there's what they call Cologuard, and I think the insurance companies are paying for it as well.
They ship it to your house?
Yes, whereby, there's this company, all they need is a stool sample. But it's not for everybody. So if you are high risk with like family history, we wouldn't recommend you to do Cologuard because you're already a high risk subject. However, if you are just low, medium risk, no family history before, no pathology to suspect that you should have colon cancer, and you don't want the doctors to go in and do a colonoscopy, you could ask for that. However, if you do they'll send you the kit to your house, you send them your stool sample, you ship it back, the company will do all what they have to do, and they will tell you whether they feel there's anything suspicious. If they find anything suspicious, then they recommend that you should go and get a colonoscopy. So what you're kind of trying to hide from, you may eventually get to do it eventually. So that's why you have to ask yourself, is it worth it? Why not just go and do the colonoscopy straight away, which tells you whether there's anything for them to follow up on.
I think our time is up. I want to thank Doctors Adefori and Ogunde. Please a round of applause for them. So we'll see you all next month. God bless. Thanks.